everyone. I'm Marlena,
And I'm Ashley.
and we're here with Sallie today. And we are all going to be talking about MS. March is MS or Multiple Sclerosis Awareness Month. And we thought it would be really cool to spend some time with Sallie, who works for the National MS Society. MS, a lot of people believe that if you get diagnosed with MS, that it is going to be a quick and rapid decline towards disability. And that's the myth that we're going to be focusing on debunking today. We want to remind everyone that we're going to be keeping in mind our real core values. So we're going to respect the journey, especially that every MS diagnosis is unique and we honor each person's experience. We empower insights, so knowledge is power, and we're here to provide all real and accurate information. We want to have authentic conversations. We'll be talking about the realities of MS in an honest and compassionate way. And lastly, we want to try to keep the conversation lighthearted when we can and having that connection. MS is a serious disease, and we're not meaning disrespect by that, but it isn't all negative, and I'm keeping it uplifting as well. So our guest today, Sallie Stephens, knows about this topic inside and out. She works with the MS Society in helping connect families and with their healthcare providers and people living with MS for the best resources. Sallie, tell us a little bit about yourself.
Yeah, hi. Thank you so much, Marlena and Ashley. Thanks for having me today. I'm just really thrilled to be able to be here and also to represent the society and someone living with MS. And as you mentioned, it is MS Awareness Month, which, gosh, it was founded in March of about 1947 by our founder Sylvia Lowry. And so that's why we like to really shine a light on multiple sclerosis during the month of March. So yes, I do live with MS myself. I was diagnosed about 13 years ago. It was a long process for me. It isn't always that way for everybody, but it was definitely a long process for me of getting diagnosed. I had had symptoms many, many years before that. But I was a runner and I noticed that I was having tingling and falling. And so I went to my primary care physician. He didn't really know what was going on, referred me to a general neurologist. They kind of figured out what it was, but it wasn't until I actually went to another neurologist where I was actually diagnosed with multiple sclerosis. So to me, it wasn't that devastating because I didn't really know what MS was. I did not go to Dr. Google, thankfully for that, because sometimes that can just be overwhelming. But we can talk more about my journey as a person living with MS later if you like. But I also do work for the National MS Society, and I've worked with the society for 7 years. I'm what's called the manager for healthcare stakeholder engagement. So that means I work with healthcare providers, and that includes neurologists, people like Marlena, social workers, rehab specialists, advanced practice providers, and I do that for the entire Midwest. So I cover 10 states in the United States, and I just build those relationships and serve as a liaison between the society and those healthcare providers.
That is amazing. What a big title and a big job.
Yes, yes. And I love that you're able to bring both professional and personal insights to this conversation. I think it's super important for people to understand both sides of the disease and how it can affect people. So thank you for sharing.
Oh, you're most welcome. And it's been really helpful for me, I think, in relating to not only people living with MS, but also just relating to those providers too, because they can kind of see, a different side of not everybody that works at the society lives with MS. There's only a few of us. So it's kind of, I wouldn't say it's special, but it's a good opportunity again to shine the light on the disease and how it affects people differently.
Absolutely. So let's start with the basics, Sallie. For those who might not be really familiar with exactly what multiple sclerosis is, how does it affect the body?
It affects everybody differently. So we like to call multiple sclerosis the snowflake disease, just like a snowflake. No two are the same. No, nobody is really the same with their MS diagnosis. And so that's why it's so hard to diagnose a lot of times, because it's more of a ruling out everything else because it mimics so many other different types of diseases. It's more of ruling all of those other things out before they can make that official diagnosis of MS. Would you like me to tell you a little bit about how it affects the body or what the disease looks like? Would that be helpful?
So,
Yeah.
Yeah. So for those who aren't familiar with multiple sclerosis, it is an autoimmune disorder. It's, if you know anything about autoimmune disorders, that's when the body sort of attacks something within the body. So in the case of multiple sclerosis, it is the body attacking the spinal cord and the brain. So what happens is we have something called a nerve fiber, and we have outside of that nerve fiber is something called a myelin sheath. So if you think of it as like an electrical cord, I'm looking here to see if I have one, but I don't really have a good example. But here's an electrical cord, and it's got that protective coating on the outside, but inside, if you were to open that up, there's all these different little fibers, and those are the nerve fibers. So that myelin sheath is that fatty coating that protects those nerve fibers. And when you have multiple sclerosis, the body is attacking that myelin sheath and causing it to wear away. And when that wears away, then it causes lesions either on the brain or in the spinal cord or both. And when that happens, all of that information, as you know, your spine and your brain, that's where information travels and tells your arm to move or your face to smile or whatever. That flow of information is interrupted because that myelin has worn away, and it sometimes even causes the nerve fiber to break apart.
mhm.
When you've got those lesions on your brain and on your spinal cord, it disrupts that flow of information and it causes you to have all kinds of issues. And everybody again is completely different, but the myelin sheath can be repaired, which is a nice thing to know. But what they're really working on now in all of our research is just really finding good ways to repair that myelin, because multiple sclerosis, there's no cure for it right now. I like to say right now, because we're hoping that we do have a cure someday. And I would be happy to be out of a job, to tell you the truth.
I
But
guess.
so that is something that they're always working on, is getting that repair and getting it even in further stages of MS, repairing it, as opposed to just when somebody's first diagnosed.
Yeah, and I would assume that a lot of people think once you get that diagnosis that things progress really quickly and that all MS is the same. So I know you said the types of MS, the way they're classifying that is changing a little bit. But can you tell me a little bit more about maybe different degrees or how that looks for individuals?
Happy to do that. Yes. Well, we've got several different types of MS. There's something called clinically isolated syndrome, and that's when you just have symptoms over a 24-hour period, and it just happens once. So it could be MS, it could be something else. You may not even go to the doctor for that, but you may remember, oh, I had this horrible time when I was really dizzy and I couldn't see, and I just felt really out of it. That's called clinically isolated syndrome. Once you've been diagnosed with MS, they have three specific categories, or they call it course descriptors, which actually that's going to change here really soon, because this has been around for quite a while, but I'll just tell you what it is right now. So there's the most common form, which is the type that I have, is called relapsing remitting. And that's where you will have symptoms, and then you'll have a period where you're doing okay, and then you'll have symptoms again, usually a little bit more severe, and then you'll do okay. So you're going to baseline and then up, and then baseline and then up. That's relapsing remitting. I think about 80% of people living with MS have that type. There's another type called secondary aggressive, which a lot of people living with relapsing remitting do go into that stage. That's more severe. That's where you will see people that are, they'll use walkers because they have bad balance or they can't walk very well. They have some stiffness or tightness in their back of their legs, just a lot of different issues. So it's just a further progression of the relapsing remitting. And then there's also something called primary progressive, which is the most rare form of MS. There's only about 10% people that have that. And that's just where you steadily increase. So Marlena, that's what you were talking about. Like you're diagnosed and then all of a sudden you just go from walking and doing everything to being bedridden. And that's not always the case, but with primary progressive, there is a steady increase in the symptoms, and you tend to lose a lot more of your abilities with it.
And how is that determined? Is it just by symptoms on which classification you have, or is there a test that shows if you have a more aggressive form?
A lot of it goes by symptoms, but when you're testing for MS, like I said, it mimics so many other different types of diseases that it can involve a lot of different types of tests, but the most common is to have an MRI, and that's where they can really look to see if you have lesions on your spinal cord or on your brain. Depending on how many lesions you have or where they're located, that also helps determine the type that you have. And also, where you have those lesions, it can affect the way your symptoms present themselves. So let's say if you've got lesions in your brain, you may have more problems with your eyes, seeing things, something called optic neuritis. Whereas if it's in your spinal cord, you may have more problems with your walking. I'm just using that as an example. And that's not always the case, but that's generally the case.
That makes a lot of sense.
Yeah, absolutely. So it doesn't always mean full on disability. Like if we look at somebody like yourself, you're still out here working and advocating and doing all of the things. Can you tell us a little bit about what life looks like for somebody like you who lives with this disease that's still
Sure.
active and independent?
Thank you for asking that. Yes, you're right. And not everybody, it's not an automatic death sentence. It doesn't automatically mean that you're going to be bedridden or not able to walk, although there certainly are people that do have that. As I mentioned before, there's no cure for MS, but we do have what's called disease modifying therapies. I call them DMTs for short. When I was first diagnosed, there were probably four, and now there's over 25 disease. So just to sidetrack just a little bit, there's anything from pills that you take, like twice a day, once a day, there you can give yourself, and then there's also infusions as well. So you can have an infusion once every 6 months, and every day there's more medications coming out. But the big thing is to, and this is what we're working on within the society, is for people to get diagnosed earlier, because the big key is to get those DMTs, those disease modifying therapies started in your body. Because while there is no cure, the disease modifying therapies can help slow the progression of the disease. And those medications now have become so advanced and so effective that the earlier you're diagnosed, the sooner you can get on the medication, the greater chance you have of it not progressing.
Which is
So,
just phenomenal, and
yeah.
so thankful for all this research. So, what do you think are some of the biggest misconceptions about MS?
Oh gosh, there's probably a lot. Like I said, first of all, I didn't know even what MS was. I think I had maybe heard of it, and this was just like 13 years ago. I didn't know very much about what it was. I thought it was muscular dystrophy or, those all those abbreviations and acronyms. Sometimes it just gets very confusing. So
Agreed.
one of the big symptoms for people is fatigue. And that's something that I suffer with a lot myself, and cognitive issue. You forget things. You sometimes feel like you have a foggy brain. So some misconceptions for people. Sometimes your family member doesn't believe that you have this unbelievable fatigue that just kind of knocks you out and you can't do anything. It's more than just being tired. And the same thing with those cognitive issues, or sometimes you can't get your words out, and sometimes I'll try to say a word and it won't come out the way I wanted it to. I want to say the word envelope and I say square boxy thing because I can't think of that word. Now, we all have those instances. So, just because that happens to you doesn't mean that you have MS. But I do think the big misconception with families and with caregivers is They're not really sure, are you faking it? I have even given out little cards to people that say my speech is slurred because I have MS. It's not that I've been drinking. I've never personally had to use those cards before, but I know that some people have. Other misconceptions, doctors sometimes will dismiss your symptoms. Some doctors aren't even really aware of what MS is. And there's no blame that I'm putting on doctors because they have so much that they have to know and learn, and there's still so much unknown coming from about MS and how it affects the body. So that's another thing that we're really working on, is just trying to inform those general neurologists and primary care physicians what those symptoms look like so that they don't dismiss those symptoms. I hope that answers your question.
That's amazing. The amount of knowledge you have is just fantastic. I've learned so much already today. So thank you
Yes.
very, very much. I guess one other thing, what about resources? Where can people go to get more information if they have a loved one with MS or they're thinking that maybe they have some symptoms that they should get checked out?
Oh, that's a great question. Well, the National MS Society is a wonderful organization. I might be a little bit biased since I do work for them, but that's where you can find all kinds of information. You can go to the website, which is www.ms. Well, let me make sure I've got this right, nationalmssociety.org. I go to it so many times I forget what the actual URL is, but there's all kinds of resources there. There's stuff for people who are newly diagnosed, information to read about yourself, what's going on, how to tell your employer that you have it if that's something that you choose to disclose, places that you can get help from your physician or durable medical goods. We've got a program called the Navigator program where you can actually talk to a trained therapist or social worker. They will just give you all kinds of information. Let's say you have questions about insurance or Medicare or Medicaid. They can talk you through that process. They can help you find mental health providers. Nowadays it's so good that we are talking more about mental health for everybody, not just for those that are living with chronic illness. I'm so grateful that that is starting to come to the forefront. So there's no shame in having mental issues with any type of chronic illness. So they can help you get connected to a mental health provider. We've got self-help groups that are all over the country, virtual and in person. The one good thing about the pandemic, I would say, is that we became so much more used to using virtual platforms. So a lot of doctors now do telehealth, and then we do self-help groups that are virtual, especially if you are having issues with getting around. Sometimes that virtual community is really great. And it also connects you to other people living with the same thing. So I would say go to the National MS Society. There's other organizations out there too. I think it's the MS Foundation. So we all support each other. We're all here to find a cure and to just help people who are living with MS live their very best life.
Well, I just so appreciate all of the work you're doing, and thank you for sharing your story and a little bit more about your journey with MS. And, I think we've debunked quite a few myths about MS, things that I didn't know for sure.
Yeah, I
That's
agree.
great. I love that.
Yes, thank you for sharing.
So if you all found this episode helpful, please like, follow, subscribe to The Care Truth. We're going to be doing another little vignette on MS. We're going to be talking to a few of our residents at Geneva Suites about what their journey has been like and give a few more personal stories on our next episode. So thank you again, Sallie, for joining us. We will have contact information for Sallie in the comments below. And also, if you want to connect with the National MS Society, their number is 1-800-344-4867. Thanks so much, everyone. Have a great day.
Bye.
Thanks for having me.